The Trump administration has issued a proclamation to bar entry to the United States for illegal immigrants who cannot pay for health care or coverage. This is a proclamation that was ordered on October 4th. It is scheduled to take effect November 3rd. It is impacting people seeking entry to the United States that are required to meet this new proclamation mandate or be denied entry. Now, it suspends or limit entry of legal immigrants if they are considered to, and this is the wording of the proclamation, if they are someone that might be a financial burden to the United States healthcare system. Now, they consider someone to be a financial burden unless they can show that they either have health insurance, can quickly sign up for health insurance, and that's typically within a 30-day window, or they can otherwise afford to be reasonably expected to pay for medical bills. So that's the threshold question that this proclamation now mandates of anybody seeking lawful entry to the United States. What counts as health insurance is a little questionable. The listing in the proclamation says that employer-sponsored health insurance counts as coverage. Short-term plans, which we also know as junk insurance, counts as health insurance, even though those are very limited plans that do not have to follow the mandates of the Affordable Care Act. No essential health benefits, no maternity coverage, no prescription coverage, very skimpy plans, but that counts under this proclamation. Unsubsidized individual markets in plans in a state. So if you're not getting tax subsidies, but you buy a plan outright, that counts as insurance, as does things like TRICARE if you're in the military or Medicare. What does not count as insurance are things like Medicaid or health insurance through something like the Affordable Care Act Marketplace that comes with the tax subsidies. So if you get Marketplace subsidies that are with your Obamacare plan, that is not considered sufficient health coverage for purposes of this proclamation. Now, the impact is seen to be quite broad, but the fear factor, just like other immigration policies we've seen coming out of this administration, is what's keeping a lot of people from the health insurance they're legally entitled to. The standard for Affordable Care Act plans is, are you lawfully present? Someone coming lawfully to the United States is entitled to buy that insurance. Somebody lawfully present in many states is entitled to sign up for Medicaid, but in this instance, that would be used against you for purposes of entry. It's sounding a lot like some of the language in that public charge rule that was just struck down by a federal court. Now, the biggest population to be impacted, even though this rule is technically for adults, a lot of health policy experts are saying, yeah, but it's really going to impact the kids because parents will be afraid to seek entry to the United States to get the services they need for their children. Even though this isn't directed at children, it still might trickle down and impact them, that they don't get the health care that they need and deserve. It might keep otherwise eligible individuals from enrolling in plans. It couldn't be used against you, but they still might think it is. And then, of course, there's just the confusion factor of who this applies to, what type of lawful entry, what type of interview it's going to look like. The largest population of uninsured individuals in the United States is not immigrants, it's U.S. citizens. And a lot of health professionals and health policy experts are saying this policy, while saying it's trying to chip away at uncompensated care, is doing nothing to the bulk of the uncompensated care population, which is U.S. citizens. So its misguided attempt instead looks more like another way to chip away at the immigration rules that we have in our country. If you want to read the proclamation yourself, we link to that in the description below. Now, the world of immigration and healthcare coverage colliding has been in the news quite a bit. As that changes, we will continue to bring you updates. So please subscribe to stay up to date.